Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to The Valley Today. I am your host, Janet Michael. Happy Monday as you are listening to the show today. We, of course, have pre-recorded our conversation on the Zoom screen. We are chatting today. We've got some really great information for you today. We're chatting with Pam Murphy. She is the Executive Director at the Shenandoah Community Health Clinic. Joining her on the Zoom screen is Dr. Pino. He is their dentist. So I've all morning, as I've been looking at my notes, Dr. Pino, I've been trying not to think of Hermie from the Rudolph show because he is like my favorite dentist ever.
Thank you. Thank you so much.
Well, Dr. Pino is our favorite dentist, just so you know. He's well beloved in this community. So
Pam, before we get too deep in the weeds with our conversation about the dental services that Dr. Pino offers at the clinic, tell me a little bit about the clinic. What are all of the services that you guys offer?
Oh, it seems like it's growing all the time, but we have family medical care. That is everything like your regular primary care doctor, adults, children, the female cancer screenings. We can do all of that. We also have a program that people probably don't know as much about, and that is medication assistance. We help people acquire the expensive prescription medicines that they can't afford. A lot of medicines are available through the pharmaceutical companies, but you have to do a lot of paperwork and send in income information and all of that. Well, it's kind of a nightmare, honestly, but we're experts at it, and we help people get through that challenge and get the thousands of dollars in some cases of medicines each month. We also have psychiatric care and counseling, licensed counselors who are providing therapy. We have the therapy, particularly counseling, for school kids in the schools. We also, quite a bit of our services during the pandemic, as far as behavioral health, went to telehealth. So we do a lot via that way, but we see folks in person as well. So that kind of summarizes the main programs that we have.
And your programs, are they income-based? How are your fees structured?
You can pay full price which is like the going rate, I guess, if you don't show us any income information. So you, me, or anybody off the street could come and become a patient and not show any income information. But if you do want discounted fees, maybe you lost your job or your hours have been reduced, or you're just always barely making it as it is, we can still help you. And we need to see that income documentation in order to figure out what is the appropriate fee. We have a sliding scale of fees. So the fees can be as low as $2 for a counseling visit. I think the dental clinic is charging as much as $100 for a surgical extraction, like a wisdom tooth. So there's a range. Obviously, it depends on the service and it depends on your income, but we can help quite a bit if you have a very tight budget.
And do you accept insurance?
We do. The dental clinic has been long time acceptors of Medicaid. And I'm excited at some point for us to talk about some of the changes coming to Medicaid that is going to help a lot more adults. But the medical clinic also takes Medicaid and private insurance of all kinds, really. And a lot of that was driven by the fact that we started working in the schools, and a lot of the children have insurance through their families, or they might have Medicaid. But there was, before that, like a 6-month wait to get into counseling services. And when we found that out, we knew we had to get involved and try to do what we could to kind of, help. So yes, we take all kinds of insurances.
So, Dr. Pino, how long have you been offering dental services at Shenandoah Community Health Clinic?
I jumped in this adventure since 2014 already. So it's going to be 7 years kind of already. And I'm glad that I jumped in because I like, honestly, as a dentist, as a human being, to help people. And this is why when I came, Pam will tell you about this. When I came for the interview, the beginning, and she was telling me, this is a free clinic. We help the community. I think this is it. That's what I want. So that's what I'm here. Yeah.
And sometimes it's odd too, because you'll a lot of times see a dentist that specializes in adults only, or some of them are oral surgeons, so they're only doing surgery and wisdom teeth and things like that. But I would imagine at the clinic you're seeing a wide range of patients with a wide range of ages.
Yeah. I mean, in the beginning, it was, I think, for me, a challenge because I'm Spanish speaking. And then obviously when Pam asked me in the beginning, hey, do you work with kids? Yeah, when they speak Spanish, it's easy for me, But I mean, in the beginning, it's really hard to work with kids. And this, I'm saying this in the best way possible, because you never know what the kids comes like in the background, like even in the house, even in a past dental history. So every single kid, it's new for me. So we try to change what they have already in the mind, like it's afraid of this. So I'm really like outgoing with the kids, and it's going really well with them. I mean, they like to come here. But what it's true is, like in any general dentist practice, because I'm a general dentist, we have limitations for different things. So what we do most of the time is try to do everything in the house, what we can do. When I see something that we need to be seen by specialists, for sure, I send them somewhere where we can try to talk with any doctors that they have or they see these patients. But most of the time we see kids and we see adults that, like, lately the adults, they like to come and see me. So I'm glad to do that. And they're really happy when they come here, because I try to ask about the problem, try to solve the problem here. And I change the fear most of the time. It's something that it was working pretty well, and I hope that it's still working. Yeah.
Well, and sometimes it always strikes me as funny, even from my own personal experience, is you can live with a lot of pain for a long time because of the fear of
Right.
going to a dentist and what you perceive of how much worse that pain's going to get.
Yeah.
And that's not what happens. I mean, you go in, you get the problem fixed, and it's like you've got a whole new life, and
Yeah,
you're
it is
kicking
true.
yourself for not making that appointment
Yeah.
years, if not months and days earlier.
Yeah, absolutely. It's always been like, the fear to being a dentist. It's kind of funny, a little short story. I've been talking with a lot of my colleagues, dentists around, and the first thing that a lot of patients said, I don't know why, it's, hey, by the way, I hate dentists. And then, what I was thinking about, and sometimes I talk with my dental assistants about it, like, not even one dentist can go back and say, like, hey, you know what? I mean, I don't like to see patients, Like, how can you say that? So what I tell them all the time is, like, I know, I understand. It's not about you. It's about, like, all the dentists. But I mean, we get that all the time. I think that being a dentist is kind of like, scary sometimes, but we try to change the mind, as I said, and we're working and we're doing a pretty good job on this.
Yeah, that's what I was about to say, is that some people have come and they've had some bad experiences. Children, particularly, they had a really bad experience with the prior dentist, and and they're really afraid. And it takes Dr. Pino a little time, and he is great. He's worked with children with autism and special needs, and he's worked all the way up through senior citizens. We have the nursing homes bring some of their patients or clients to us for care, and some of those folks have dementia and bite them on the hand, and they all different kinds of special needs people that he is trying to help and support. And so I think that ultimately the patients do realize that he's really trying to help, and they take more comfort and trust in him.
Do they teach that in dental school? Do they have a separate class for how to deal with the fear and some of the, I don't want to say crazy, but the crazy patients that come walking in the door that have this unrealistic fear of you?
To be honest, I think, and this is something that is true, it's part of the experience that we get since we finish dental school and then we, jump into the career itself. And I finished my dental school in 1999 when I was in my country in Peru. So I had a lot of years of experience there. But when I came to the US, to Connecticut, because I did my dental school in Connecticut, Yukon, go Huskies. And then over there is the same thing. I mean, you learn day by day how to deal with special problems that the patient has. But I think it's something that I've been seeing, that the more that you talk with the patient, the more that easy it is at the end for them to understand what are you going to do. If you just jump in and being like, like a grumpy doctor, open, do this, patient's going to be like, hey, I don't like this guy anymore. That's why we have a lot of waiting lists now. I think Pam knows about this. So we have a lot of patients coming here because the way that we trade them, the way that I trade them, the way that we all as a group, as a team, try to go with the problem that they have.
And that makes a big difference, because if you can like and trust the person, then that fear factor goes down so far because you do have that knowledge. I think sometimes we just want to know, well, here's what I'm going to do. Here's what it's going to feel like, but this is what it's going to be like when I'm done and it's over.
Yeah.
It relieves a lot of that fear and stress.
Yeah, absolutely. I think I can talk, not with special names. We cannot do that. 2 days ago, was a patient here that she came in the morning because we have to do 3 extractions. One, it was surgical. And as soon as the assistant comes to me and she said, like, Dr. Pino, she's crying. She's so afraid. She's like shaking. And I said, like, it's okay. I'm going to talk to her. So I'm going to tell you, it took me 20 minutes to finish the procedure with her. And at the end, even if she was like in tears still, she's like, thank you so much, because I mean, the way that you talk, the way that you guys do the whole thing. So I think that's the key. We need to go to them and try not to say, hey, this is wrong. You need to no, we need to go ahead and say, I know that we have fears, but let me tell you, we're gonna use this. We're gonna do this. You're gonna feel this, but it's okay. So if you have like time to do it, I think everything goes the way that you want it. That's the key.
Several years ago, I had to have multiple teeth pulled, and my thing wasn't so much the pain. I have this crazy aversion to hearing the noise in my head, and it just gives me this gag reflex. I can't go to a chiropractor. I don't like hearing knuckles cracked. It's just this weird thing. And after explaining that to the dentist that pulled my teeth, he said, well, here's what I want you to do. Bring headphones.
Yeah.
And listen to a podcast or listen to music. He said, you're still going to hear the noise, but it's going to be distracted. And that's the kind of thing that you do. You stop and you get to know who you're talking to, so you can treat them, the whole person, not just what you're about to do inside their mouth.
Yeah, absolutely. I think there's different ways to do it. And in the beginning, maybe it's going to be hard, but in the meantime, because I don't see just patients for one appointment, normally they come back for the next one and the next one. So in the meantime, we get in like a relationship, and they know what to expect. I know what to expect from them, and it becomes like that, and the idea is to let the patients in general to know that every 6 months they have to come for a checkup, even if they don't have anything. So that way we prevent to have something in the future.
Well, let's take a quick break. When we come back, can we talk about some of the specific services? You've touched on a few of them here, and what the process is like on the administrative end. How do they get an appointment, children versus adults, things like that. Can we talk about all of that in the next segment?
Absolutely, yes.
Okay, we're going to take a quick break. When we come back, we're going to continue our conversation. We are pre-recording today with Pam Murphy. She is the executive director at the Shenandoah Community Health Clinic. Joining her on the screen is Dr. Pino. He is their dentist, and I like him already. So, Pam, I've got insurance. I need a checkup. I may have to talk to you during the break about how to schedule an appointment to come see Dr. Pino myself. We're going to talk more about their services when we come back in just a couple of minutes.
Got a financial decision to make or a goal to reach, but you don't know where to start? You've come to the right place. Introducing Quick Money Chats with the Northern Shenandoah Valley Financial Education Program. Visit tinyurl.com/quickmoneychat to schedule a virtual chat with a staff member or trained volunteer. We won't tell you what to do, but we will give you the tools you need to choose wisely. And because Virginia Cooperative Extension is part of Virginia Tech and Virginia State, your land-grant universities, you can be sure that our information is credible and trustworthy. And you'll know that we aren't trying to sell you something. Maybe you want to improve your credit score, or reduce your banking overdraft fees, or even figure out if you can afford to buy that car. Sorting through tons of information on the internet can be overwhelming, and sometimes it can be hard to know who to trust. Schedule a quick money chat and get the information you need to take action. Go to tinyurl.com/quickmoneychat and get financial education personalized for you.
Welcome back to the Valley today. I am your host, Janet Michael. Happy Monday as you are listening to the show today. We, of course, have pre-recorded our conversation with Pam Murphy. She is the Executive Director at the Shenandoah Community Health Clinic. Joining her on the screen is Dr. Pino. He is their resident dentist. And Dr. Pino, when we went to break, I said I wanted to talk a little bit about the wide range of services that you guys offer. You mentioned before we went to break about prevention. And I think so many times, especially I would imagine the population that you're serving, people look at dentistry as a luxury. So that prevention aspect just never happens because it's just not something that's in the forefront of their mind. But prevention really is key to a lot of the problems that you see, I would imagine.
Yeah. Most of the time, what I hear from people is like, hey, you know what, my mother or my dad, they have bad teeth. They had the teeth pulled when they were like 18, and same with my grandma and the past. So I know that I'm gonna have my teeth pulled, and I changed the mind of them. I said, even if you're a kid and you start to prevent, like doing just regular things, brushing, flossing, try not to use too much sugar on the diet, with that, I think is going to be a key that in the future we won't have those problems. So that's kind of like prevention. That's what we go to the schools. I think Pam was mentioning that. And we were doing this during this last year's, going to the school to do some prevention with the kids. We can talk about fluoride. We can talk about sealants, that those are treatment that we do to prevent future cavities. Now, when we have already a tooth with a cavity or some teeth with cavities, we have kind of treatments to do that. We have to do fillings. We can do still prevention with fillings. Now that with the materials that we have in the market, and we have a lot of new materials here, it's different ways to try to prevent that the tooth need to be pulled. Because that's the other thing. That's the next step. When we have already a tooth that completely gone, we have to go ahead and do some of the surgeries here. That's what Pam was mentioning in the beginning. Surgical surgeries are the ones that they are really hard. When they're all broken, the gum is on the top. That's what the patients are really afraid of. How are you going to pull this tooth? I said, like, I have a magic for you, a magic trick. I said that, but it's true. I mean, we have to have some skills to get those extractions, surgical extractions done. If we go to any oral surgeon, private offices, obviously it's going to be a lot of money. That's what Pam talked to me in the beginning. If we're here to help, how we can do this, how we can charge them. Medicaid obviously help, and they take care of when they have insurance. But I mean, with the prices that we have here, is really people can't afford that. Even if they have to pay out of pocket, they go for that because they know that it's going to be a lot of help. And the other thing that I mentioned in the beginning of in 2014, I asked Pam, Mike, can I do root canals? Pam was like, yeah, absolutely, you're welcome. Because I mean, root canals is really a treatment that not all the dentists, general dentists, we do, because it's a little tricky. But as I said in the beginning, also, we have limitations. There's some teeth that I think I rather send them to the specialist because it's better for them to do it. And with that, we can prevent to have people with no teeth. And I've been seeing also a lot of people here that they have to do all the teeth extractions, and we have to go ahead and do some dentures on it, and we're working on that too. So we have a different brand of a lot of treatments here for the people in the community. I obviously invite you to come to the clinic because we can talk about that here. And one thing that Pam mentioned, and I think I'm gonna give this to Pam in the beginning, right now, I'm sorry, it's about the oral cancer screening that we are offering to the people. Pam, do you wanna say a little bit?
Yeah, so we bought a new tool that, and actually Dr. Pino probably is more knowledgeable in this case, but it has like an ultraviolet light that he can use in a darkened room and scan it through a patient's mouth and identify an area that looks suspicious and let them know they should go see a doctor. It is a free service that we're doing When patients schedule exams, we offer that they can get a cancer screening if they want to take that extra couple minutes, that we can do that. And it is something we're doing for free. It is something that other practices usually charge money for. But it's important to us that a lot of people, I mean, I hate to say, a lot of people have used tobacco in their past. They're still using tobacco, and that's one of the big culprits for oral cancer. We lost a board member some years back from oral cancer. So I'm very sensitive to the fact that, yeah, there's the prospect of it is out there, and that's one of the main concerns that tobacco raises. So I'm really glad that the dental team is taking this on, and going to be able to, because they see over 1,400 patients in a year. So that's a lot of those are kids, but that's a whole lot of people that they can be potentially screening and finding cancer. So.
Are the kids easier to deal with sometimes, Dr. Pino, than the adults? Do you find sometimes when the kids come in, they're a little bit easier to get comfortable in the chair?
Yeah, and every time that we have a meeting with Pam and with the team in general, we talk about some stuff, and then a new idea come to us. And this is how we get to the Bell machine, that is the oral cancer screening. When we talk about like sedation and stuff, we use nitrous oxide here. We could use the gas for a lot of kids and a lot of adults too. So every time that I talk to Pam and any meeting that we have a new idea. Hey, make a note on that, and then we talk about that. And then, I mean, the way is just to improve the clinic and at the same time help the clinic. So we have to help the community, because we have to see the price, how much we're going to charge. And this Bell machine is FDA approved. And actually, what I can see is obviously men are more kind of like 1.7% of the men are getting cancer. It's kind of like the data that we have. And 0.71, it's in women. And with this oral cancer screening, what we can do is do an exam. It takes like 2 minutes, maybe less, 1 minute. So we can see any area inside the mouth that we can probably see that something is going on there. So we can early diagnose that, and we send them to a specialist, oral surgeons, or any or doctor itself, a medical doctor, so they can take care of that before it becomes something major. And it's true, what Pam mentioned is that tobacco is one of the main things. Also alcohol. I mean, we are social sometimes drinkers, and some people is like really heavy drinkers. It's another of the data that I have that makes oral cancer going on patients.
See, I never would have thought alcohol. I immediately, when she told me during the break about the oral cancer screenings, my first thought was the people that put the stuff between their lips and smokers. And I immediately went to tobacco. Alcohol never would have crossed my mind.
Yeah, absolutely. I see some patients that when I do the exam, I see some areas and I start to talk about the Bell machine. They're kind of like afraid. They're like, oh, what if? I mean,
it's going to expose their bad habits.
Right. And then I said, hey, this is the moment to do it. This is the moment to do it, so you can have a diagnosis earlier. And then if something's going on, it's going to be good for you. And a lot of people, they already started to do this. I mean, we need to probably spread the word a little bit more. We're going to work on that soon. And then I think people is going to get this exam. And it's a lot of private offices, they're doing this Bell machine. It's really good, because I mean, you can see stuff that you don't see normally, that you don't even feel sometimes. So it's good to have this exam done.
So much of what you do, I imagine, is on an educational level. I mean, you mentioned earlier about sometimes the kids come in and they're afraid because their parents have had a bad experience or what they've been taught. It is so different now coming into a dentist office than it was even 10 years ago, much less 25 or 30 years ago. Pulling your teeth isn't just the first and only option anymore.
Right. Anymore. We have different options. And obviously, also, everybody knows that dentistry is a little expensive, but there's a different kind of treatments to safety when we don't have the money to save it. I mean, the only way to do it sometimes is pull it. But even though we can put partial dentures, use dentures, now we have implants. That it's another thing that some patients they want to do that. Hey, I lost those teeth, I need to go in, but we don't do implants here, but we can guide them how to go to a specialist to do that, and what are the pros about have that,
It amazes me just watching how far it's come. I mean, it's crazy. I mentioned, my personal experience. That was 10 or 12 years ago. And if I walked into a dentist office today with the same issues I had then, I'd probably have a whole different outcome. It is crazy.
Yeah. Day by day. And I have to go with the coronavirus, with all the pandemic and stuff. We do a lot of online seminars and courses. And then every time that I do one, I'm impressed. Hey, we have this new material. We have this new machine. That's how we started the Bell School, because I hear that on a friend's office, and new stuff is coming. And every day by day, we have new stuff coming for sure.
Now, Pam, speaking of new stuff, you mentioned at the top of the show that you guys accept Medicaid. And during the break, you told me July 1st, that's going to kind of get supersized.
We are so excited. Yeah. So children have had access to get their fillings done, regular cleanings, all the goody crowns. They have really had access to be able to do everything if they had Medicaid. Until July 1st, adults have had very limited access to dental services. They can have tooth extractions, they can have the x-rays, in order to get the tooth extracted, but they didn't really get to do fillings and dentures of all things. The new Medicaid that is coming out July 1st is going to help really cover the majority of the cost for dentures, root canals, crowns, fillings. It's like it's as good as what the kids get, and we're so thrilled. We have a lot of patients who, have to work for months to try to save up their money to get an inexpensive crown that we've got produced for them. We can discount our labor to a great degree, but we don't have control over what goes into the labs, the dentures, the crowns, all of those things. We have to pay whatever that cost is, and that cost is passed on to the patient. Well, now with this Medicaid subsidy, it's going to be huge. There's going to be a whole lot of people who will be able to get services that they weren't able to get. And we encourage folks that have been postponing getting dental care because they didn't think there was really anything that they could do except get a tooth out, to come check it out now, because there's a whole world of options that weren't there even 3 months ago. So,
and does that start with just a phone call to the clinic? I mean, what is the process for somebody to get an appointment or at least get a consult?
They should call the clinic. That number is 540-459-9333. The nice gals at the front desk will talk them through the type of documentation we need if they do want the discounted services. Once again, they could pay full price, and get these services. But many people in our community, I checked with the Department of Social Services. They said there's 10,000 people just in Shenandoah County that have Medicaid. So we could be busy all day and night trying to serve 10,000 people. That's a lot of people. So anyway, we could talk them through the documentation that we need, or get their Medicaid card number and get them an appointment set up.
Now, do you just serve the residents of Shenandoah County, or do you serve some of the surrounding counties as well?
We will try to help anybody, but the Shenandoah County folks have a lower pay scale that we offer to them. And that is in large part because most of our donations and funding from our Board of Supervisors helps to support Shenandoah County. So we probably have a handful or a dozen folks that come from outside of the county, but most of them are Shenandoah County residents.
So, Dr. Pino, before we wrap up, do you want to give some advice to parents or adults out there for what they should be doing when they roll out of bed every morning?
Yeah, I all the time to the kids, I said, how many times a day we need to brush? 2 times is the best way to do it, in the morning and before they go to bed. That's the most important. We're going to spend like 6 to 8 hours sleeping. So if we eat something before, something's going to happen. But if we can do that after lunch 2-3 times a day, that will be the best way to do it. Other thing is, like, parents need to take care of this. They need to help the kids in the beginning to the brush and keep an eye on them all the time. I do that with my kids too, because it's better for the kids to learn that this is like a habit. We need to do this day by day. And just like before we finish, actually, because of the coronavirus and all the stuff that was going on with the pandemic, we don't have the masks right now because we're in our offices, but we are following all the protocols of the FDA and everybody we're saying about how to take care of this. So if people is still afraid of the coronavirus that happens during the last year and still this year, we are doing all the protocols to help the people without being exposed at all.
So don't let that keep you from coming in and getting an appointment, because you're going to be safe.
Yeah, absolutely. I have just like yesterday, another patient. I didn't see you for 2 years. Yeah, the coronavirus. No, you can come here. You need to call, as Pam said, call. and ask all the questions that you have. We're here to help people and answer all the questions they have.
And Pam, can you give me your web address before we wrap up too?
Sure. It's www.shenclinic, SHEN, clinic, CLINIC.org.
Fantastic. Well, thank you both for taking some time out of your morning to have this conversation with me. It's been fun. I appreciate it.
Absolutely. Thank you so much.
We will be back tomorrow. It is Tourism Tuesday, and it is Lorraine's turn at the mic, and we're going to meet the new director, Jackie, for Luray Downtown Initiative. She's going to talk about her plans for 2021, some of the events and some of the cool things that they're going to have happening up and down Main Street in Luray. So meet me back here for that just a few minutes after noon.